So Gigi, after we treated your hip and later your back, you ended up with another problem that was completely separate. So tell us how you ended up back at LifeStem.
Wow. So, because every time I've had a new problem, Dr. Adams has taken the time to figure out exactly what is causing it and not just treating the symptoms. I trust her judgment and I know that she will recommend that what truly is the best option for me, not just another procedure.
So let's talk about your knee. What was happening that brought you back to LifeStem? What were your symptoms?
Well, my right knee had become extremely painful over the last 8 years. Walking was getting more difficult, but what really bothered me was going downstairs. Living in a 3-story home, stairs are unavoidable, and the pain no longer was worthy of fighting, as well as wearing knee bands, taking Advil and Tylenol, pain gels. Couldn't do that any longer.
So do you remember what the MRI showed for your knee?
She reviewed my MRI with me and explained that I had fairly advanced arthritis behind my kneecap. But she also pointed out something I'd never heard of before, the bone marrow edema. She explained that the bone itself was injured and inflamed, and that this was likely contributing significantly to my pain.
So that's an important point because bone marrow edema is something that most people don't treat. We treated both your knee joint and the bone marrow edema inside the bone with your own bone marrow concentrate. What made sense to you about that approach?
Well, I appreciated that she wasn't just treating the MRI or giving me a standard injection. She explained exactly where my pain was coming from. It gave me confidence that there was a real plan rather than a one-size-fits-all treatment like surgery.
So tell us about the procedure itself. How did it go?
The procedure itself went smoothly. Everything was explained beforehand, and I knew what to expect. Recovery required some patience, but every few weeks I noticed I was going to be better.
How are you feeling now?
Amazingly, I can say I'm feeling fantastic. I can walk without constantly thinking about my knee, and I can go up and down stairs unlimitedly. And I've gotten back to my living my life instead of planning everything around the knee pain.
That's good. So what would you tell someone else who's got knee arthritis?
I tell them not to assume arthritis automatically means knee replacement is their only option. Find someone who takes the time to understand why you're hurting. She looks beyond the arthritis itself and explained everything in a way I could understand that made all the difference for me.
That's great. Many people are surprised to learn that knee pain isn't always caused by the cartilage loss alone. MRIs often reveal an additional pain generator, including bone marrow edema, areas of stress and injury within the bone itself. At LifeStem, our goal is to identify every significant source of pain and create a treatment plan that addresses each one of them with precise image-guided orthobiologic procedures. So every patient is different, but Gigi's story illustrates the importance of treating the whole problem rather than just one part of it. Gigi, thank you for sharing your story, and I hope you don't have any more problems, but we love seeing you socially at LifeStem.
And thank you for freeing me of my pain.